It's a people, it's a community, it's a life, it's a heart, it's a spirit.
Question, the heck would you want a picture of a tattoo of $1,000 on your penis for?
What makes this book so relevant, even though it was written over 100 years ago, is that it's about terrorism.
The work, sex, cars, bars, broads.
And with children, it's building on what they have. They have great imagination.
Dementia is not a diagnosis. It's a set of symptoms.
And he kept explaining to me that I wasn't gay. You cannot be gay. You just cannot.
The main thing is to be open and honest and be, true to yourself.
Hello and welcome to Talking About. We've got a great show for you tonight. First up, our special guests are from an organization called The Body Positive, and I'm going to let them introduce themselves one at a time from me outward.
Hi, I'm Christopher Murphy, and I'm the Director of Volunteer and Client Support Services.
Hi, I'm Timothy Warren. I'm the Senior Coordinator of Volunteer Client Support Services and Special Events.
My name's Guy Bowman. I'm a volunteer at Body Positive.
Okay, and exactly what is The Body Positive?
Body Positive is an HIV/AIDS service organization, a community-based organization. It was founded in 1987 by a man named Michael Hirsch, who had an idea of a self-help model for people that were infected with HIV. It was at the height of the epidemic, and he actually started the organization from his apartment. And from that time, we've progressed to a location down in the Seaport. And we have a staff of about 10 paid staff, and how many volunteers?
We have a volunteer base of about 100 people.
Okay, and when you say a self-help model, what does that mean?
We offer support groups for people that are infected with HIV and affected, which means your mother, your brother, your lover, your sister, someone that you know in your life that is infected with HIV and it affects you. We have support groups for those people and for people that are infected or have full-blown AIDS. And I'll let Tim talk to you a little bit about the social events that we have.
Okay, okay, an overview of the social events.
Well, sure. We offer a variety of social events for the community, and we reach out to the gay, lesbian, bisexual, and transgender community, as well as the heterosexual community. We have, generally, 9 months out of the year, we have a social for HIV-positive individuals, heterosexual people, and that is held in Manhattan at the Ellington Room, generally the first Friday of the month. And that gives people an opportunity to kind of go socialize, hang out a little bit. We have a live DJ that plays music. There's dancing, healthy snacks and food and beverages. And it's a great place for people just to go, mingle, meet, and have fun. On the other side of the coin, we have what we call the Hive. And the Hive stands for HIV Entertainment. And it was put together by a group of volunteers, including myself, that reaches out and puts together social activities for HIV-positive gay men and their friends. And we rotate around the city, and different clubs generally host our events, and another outlet for people to come together, hang out, and be in a supportive environment.
Okay, and you had mentioned support groups. What types of support groups are offered?
We have, currently we have 5 running. We have a smoking cessation program for lesbian and gays who want to quit smoking, and it's a model that, that was designed to fit the psychosocial needs of lesbians and gays in the community.
Is it geared specifically towards the HIV-positive community?
Yes, it is. It is, right, exactly. Thank you. We also have a HIV-positive women's support group that runs out of East Harlem. We have a couples group for discordant couples, which means one couple is negative, one partner is negative and one is positive. And we have 2 drop-in groups. One on Thursday evening, every Thursday evening, one every Friday evening. And then we rotate throughout the year various enrolled groups where the drop-in, you can just drop into the location. The enrolled group, you have to call us and we do a client intake.
Okay, and is there a typical client?
No. No. But what do you mean?
Well, you said you do an intake. Is there Is there a typical case that you see? Or
No, I'll tell you why, because the face of the disease changes so radically every few years that, no, I mean...
Right, because people have, preconceived notions, and this is an opportunity to break some of those. I mean, what are some of the communities that are most at risk right now that you're seeing?
African American females between the ages of 20 and 35, and that is a direct, they have the highest infection rate, the fastest growing infection rate in the city, and in New York City, and that is due in large part to the down low culture, which is primarily African American men who identify as straight but have sex with men, but they keep one foot in the straight world. They have wives, or girlfriends and children and families, but they're having unprotected sex with men, and then going back to their women and infecting them with HIV. African American men are not the only men on the down low, but primarily when you hear that term, that's the
where
group
it's coming from.
that yes, absolutely, absolutely.
And are women, African American women and women in general, becoming more aware of that situation?
Yeah, it's difficult I think the black community has done a great job of starting to embrace HIV/AIDS. You know, for so many years they have kind of shied away from it, turned their back on it, due in large part probably to religious beliefs. But now they're making a concerted effort to discuss in their churches HIV and AIDS, and making it more of an accepted disease to handle. To handle? Yeah, you caught me on a roll there. No, they're making it less stigmatized in the black community. They're working very hard at trying to reduce the stigma surrounding HIV and AIDS.
And is Body Positive working in conjunction with some of the church organizations? Absolutely.
We do faith-based work. We have a very large outreach and education program that goes to, and our design is very intelligent because we target recently released ex-offenders, and who a lot of times will go in, you can find them in drug rehabilitation centers. So we do a lot of outreach in drug rehab centers in all the boroughs, and with various organizations that service recently released inmates.
And is the outreach done entirely by volunteer?
No.
No.
No. Oh, I'm sorry. I was going to say we have a peer-based program where we have about 13 peer educators that go out to various locations all throughout the city, as Chris was telling you, and they reach out and serve many different communities. We have them serving the Asian community, going to different sites. So we try to reach as many communities as possible. And basically they go to several different locations.
But it's not, so we still, of course, we deal with the homosexual community, but the face of AIDS has changed in that it was typically several years back defined as a gay white male disease. And people thought, if I'm not gay,
it doesn't have any effect on me.
Nothing, right. And we have a national helpline, and we live in a cosmopolitan area, in a major metropolitan area, where we have access to education about HIV.
All the tools are there should people want to use them.
Right. Well, there was an article recently that most Americans do not, and we're probably the most educated culture about HIV/AIDS in the world.
The New York community or the American community?
No, the American community. Right. And New York especially, because a ton of work and a lot of the research that happens goes on here. It's just to have HIV, this is the best city in the world to live in, for a number of reasons. But we do get calls still from people around the country that in rural areas that really have no understanding or education, and that's why I find it ironic when I hear on the news that South Africans, they say, don't have a high level of education about HIV and AIDS. Well, there are a lot of people in this country that are still not educated.
Right, and you had a thought on that?
Well, no, I was just listening to what he was saying. I mean, just in volunteer work that I've done, not just in New York City, but around the country, you get into the small rural areas, and it actually sometimes floors me, some of the basic questions you still get on HIV. It's 2004, and just recently I'd done an event in Syracuse, New York, where a woman who has a son, a teenage son actually, in a northern county of New York, had asked me, once she found out her son was positive, if it was possible to get it, by sharing a cup or a glass, and it kind of just really set me back, because I thought, here we are a good 25 years into this, and we're still hearing these kinds of questions, just as a volunteer and as somebody who, has done a lot of fundraising and outreach on their own for not just Body Positive, but for other organizations as a consultant. So.
And Body Positive is 501 nonprofit?
Yes, we're a nonprofit, yep. Nonprofit, we rely solely on federal aid and contributions, donations. Every year we have several fundraisers. We're always a big contributor to AIDS Walk, which typically occurs in May. Every June, the first Saturday of every June, Friday or Saturday? Saturday. We have a big event called Garden Gala, which is held on Eastern Long Island, and it appeals to a higher social set than we would typically work with in terms of donors in the city. And then we also have an event that we just started this year on World AIDS Day called Blades Against AIDS, and it's a pretty novel idea. We have ice skating in Chelsea Piers, which people thought was going to be a ridiculous idea and nobody would show up, and I'll tell you what, about 500 people showed up and we made a ton of money.
It's an amazing event.
Yeah.
Also, it's like, as they're talking about the events, I mean, our agencies, relies a lot on volunteer help, a lot. And there's so much so much to be done in so many ways that if, you're watching this and you're looking at a way of getting involved, especially with an agency, in my opinion, one of the biggest attractions for me to Body Positive was it's one of the very few, like, grassroots feel, to the organization. And so it's, it had a really good feel to me, and you get to actually see your volunteer work grow, and you actually get a lot of appreciation from it because you see some immediate results from the kind of work that you get to do at Body Positive. And so I recommend that anybody that is looking to volunteer a couple of hours a week or even an hour a week to contact us.
The organization.
Call the organization.
At what phone number?
212-566-7333, extension 14.
One more time.
Or 15.
Just joking. 212-566-7333, and you can ask to speak with anybody at Body Positive. Anybody would be happy to direct you, but Chris and myself do run the volunteer department, so feel free to contact either us, extension 14 or 15.
Right. Okay, and we will have a link to your website through the talkingabout.info website. That's www.talkingabout.info, and our time is up for this program.
Okay.
Thank you so much for having us.
And I'm very glad to hear you, to have you here. Keep up the good work. And we are going to check in with Dr. Cynthia right now. And thanks again to my guest, www.talkingabout.info, for a link to the Body Positive website. And I'll be right back.
Welcome to Ask Dr. Cynthia. I'm Dr. Cynthia Pizzulli, certified sex therapist and psychotherapist here on Long Island. Today we have an email from James who writes, I'm 18 years old and have only dated girls, but I sometimes find myself thinking about guys in a sexual way. I'm afraid I could be gay. What should I do? James, you're not alone in worrying about these kinds of things. Guys and girls your age are struggling with their sexual orientation all the time. And whether you're gay, straight, bisexual, that doesn't matter as long as you have resources and supports to help guide you through this tough time in your life. I'm going to email you some resources so that you can actually contact some of them if you feel uncomfortable or insecure. And in addition, I'd recommend that you consider seeing a therapist to talk about your desires and to determine what it is that you're really looking for in a relationship. It's possible that you are straight and that you are just having fantasies about having sex with men, which is not unusual, or it can mean that you're just still trying to determine what it is your preference is. Either way, you can be happy, either gay, straight, or bisexual. Thank you for writing. If you'd like to email me, you can at AskDrCynthia@talkingabout.info or write to me at the address on your screen.
Hello and welcome back to Talking About It. I am John Griffith, and during the rest of the program, we're going to be talking about methamphetamine. And my guest from the DEA is Christopher Giovino. I said it 2 minutes ago, and I said to you I wouldn't be able to say it in a minute. I apologize.
And I doubted you.
Well, welcome.
Thank you.
Okay, just what is it?
What is
methamphetamine?
Well, methamphetamine is a stimulant. It's actually a Class 1, Schedule 1 narcotic for us. It's been around for decades, and it is just what it says. It's an amphetamine-based drug. It's a synthetic. It's manufactured. It's not grown, and it's abused in every way you can imagine, from orally to smoking to injection to other subcutaneous or mucosal entry point abuse areas.
So it's that malleable that.
Yes, yeah, and now that it's been popularized in its crystal form, crystal meth,
right.
It's very smokable. It's more socially, in the worst way, it's more socially acceptable and more palatable to more users. It's been marketed better.
Okay, I mean, are there any particular communities that it's more prevalent in?
Throughout the country, it's spread from west to east, and it's basically been targeting and being abused by a white community, a lower socioeconomic strata across the country. It's been abused quite a bit in the gay, lesbian, transgender, bisexual communities, initially out west and now to a very large degree here in New York City. But still, we see the bulk of abuse upstate, the upstate New York area. It seems to have come down and formed a bubble around New York City, and it's really attacking one particular group of people in New York City.
And
that group would be the gay
okay.
and lesbian population in general.
And what are some of the effects?
The effects are the same as you would get from any stimulant. You know, it'd be like taking 1,000 cups of coffee. It's an immediate rush, an immediate high. It's supposedly very pleasurable. It's got, as you would expect from any drug like this, it's very much akin to crack in that respect. The highs are huge, and the lows, the time when you're falling down from the high, causes a great deal of depression. Therein lies its rapid rate of addiction. It's an incredibly addictive. It's one of the most addictive drugs that we've seen.
What is the physical cycle? I mean, does it start to take an immediate negative toll on the body?
It's immediate. Yeah, it's one of the few drugs that are out there. It's unlike almost anything that we've seen. It's again, crack. I think was probably from our perspective the last. I'm not a health expert, but it's the last drug that we have seen with this immediacy of addiction.
Are there any recognizable traits that to look at somebody who's using? Are there any recognizable traits that stand out?
Well, I mean, there's probably two types of users. I mean, there's probably a binge user, and then of course you may not notice any differences unless they're using. And then there's the habitual or addictive user. And in that case, in general, what you'll see is rapid aging. I mean, you'll see it before your eyes. You'll see the gaunt, sunken look. Food is not an issue, you know, for crystal meth users. You know, personal hygiene is not an issue. Your health is not an issue. Any conscious level of decision making in your life.
Nothing matters but the high.
Nothing matters but the high. And everything that surrounds the high, whatever sort of a society you happen to live in, whether it's, you know, in the Midwest or whether it's here in New York City. It's a very social drug, seemingly. It's not quite like ecstasy, but it is very social, and it seems to be a very cliquey drug, especially in New York City.
And where is it coming from, though?
It's coming here. It comes to upstate New York by way of mom and pop laboratories that have sprung up all across upstate New York.
And little
mom and pop, tiny 1-person or 2-person cooking sections that they'll have in a house or a trailer or an apartment, usually in a bathroom or in a kitchen, on a boiler plate, near an oven. And they're just producing enough crystal meth to sell and to use to keep the high going. That type of crystal methamphetamine seems to stay upstate and is sold and used upstate. What we see in New York City predominantly is West Coast or super lab methamphetamine, which is highly pure and comes again from the West Coast or from Mexico, where it's made in clandestine labs there.
And because it's that much more powerful, it hollows you out that much faster?
Yeah, when you take the meth that's produced, the powder methamphetamine that's produced out west in these super labs or in Mexico, or even upstate in the mom and pop labs, and you bring it down to its crystalline form, which is nothing more than adding acetone to it, you're chemically improving the drug to a pure level, which again makes it that much more dangerous, that much more addictive. And you're doing a lot of other things as well when you're using or creating this drug in a lab. And let's just use the mom and pop lab for an example. It's being done in homes and in trailers and bathrooms. It's usually done in a household where there's children, believe it or not. The byproduct from the production is such that it actually adheres to physical surfaces, walls, floors, so that when your children are crawling around the house, playing, touching the walls, it is skin permeable. Children being children will lick anything or put anything in their mouth. There are serious and there are very serious health hazards to children who are unfortunately in that atmosphere. There are biohazard byproducts from crystal meth production. You can't get rid of it safely. You just can't. And the people who make it aren't going to be looking to call hazmat to come clean up their laboratory anyway. So you've got that, and you've also got the danger of when they're cooking, because the actual cooking process is highly flammable and highly combustible.
Okay, and as far as small children are concerned, you just mentioned some of the immediate effects. I mean, has the drug been around long enough for there to be any studies on long-term effects?
Well, I think the drug has been around long enough for that sort of a study. I don't have that information offhand, but I can tell you that last year 3,000 children were identified as having come into contact with crystal meth from being around a home where it was made.
So that's not using, that's
just 3,000 poor kids that were in the wrong place at the wrong time, having the wrong parents, and that's sad.
Yeah. And what's being done to stop this?
Well, nationally and internationally, what we're doing is something quite remarkable. We're actually attacking the precursors that you use to make it. The largest precursor that you need to make methamphetamine is ephedrine or pseudoephedrine, which you find commonly in Sudafed, in a very, very pure form. So we're going after that. We're trying to curtail the importation into the U.S., the illegal importation and distribution. Okay.
Well, I mean, ephedra is no longer available for sale at this point.
Ephedrine, not ephedra.
Okay.
Yeah.
What's the difference?
The difference is that ephedrine is a legal, commonly used antihistamine that we all benefit from in its intended form. What these people do is that they divert that chemical into the super labs out west or into the mom and pop labs in upstate New York, and they make methamphetamine. So we're trying to get on top of that. But more importantly, here in New York, we have an opportunity to get on top of the crystal meth issue before it becomes a full-blown epidemic, as ecstasy has, as crack has. It's very unusual for us in this line of work to be able to get ahead of a problem. We see the problem in front of us. We've had great interface with communities here in New York City. The gay and lesbian, transgender, bisexual community, for one, has reached out and formed a coalition with us to try and get education and prevention out there. This is a drug that needs to be prevented through education, not just curtailed by law enforcement, because by the time it gets to the level of needing treatment, treatment is very difficult for this drug.
It just gets its hooks in that deeply?
It's as bad an addiction as any drug that's out there, and hard to kick. The levels of recidivism, I don't know the numbers, but if you could look online, you'd find that they're nearly, impossible to get off of. It's just it's an insidious drug. It really is.
And what work are you doing with the communities?
Well, currently we're doing outreach works with our neighbors. We happen to be in Chelsea. Our agency is headquartered there. So that's very, very, appropriate for us to form a coalition with our immediate neighbors. So we are also involved in prevention and education through our demand reduction agents, and they're free of charge to any group, agency, or educational concern who'd like to confer with us. We have a lot of information to give out, and again, it really helps us get ahead of this problem if we can contribute to helping with prevention and education. And I know that sounds crazy from a law enforcement agent, but we have learned through experience that we cannot solve this problem by ourselves.
Right. And where can people find more information? Is that if
they can go onto our website, which you can attach.
Yeah, I'll have a link to the talkingabout.info site,
Yeah.
Which will be up at the end of the show.
Thank you.
And is there a telephone number?
Sure, they can call 212-337-3900 and ask for our demand reduction special agent, and she'd be happy to speak to anyone. We're happy to help out on prevention education especially.
Okay. And just when somebody comes to speak to a group or an organization, do they basically go over the material that we went over today, and what else is covered?
Oh, we'll go into as much depth as they require. We'll provide briefings for any group, parent groups, politicians. We're going to contribute to the crystal methamphetamine public hearings that are going to be held, I think, on April 22nd at City Hall. We're going to help brief all of the politicians and the healthcare workers on what we see from our perspective from this drug of abuse, because our perspective is very different from what most healthcare professionals and politicians see.
Okay, well, I mean, we're just about out of time, and going to have you back at another time because there's plenty more material to cover on this topic, and it's just the beginning, and it is something that we need to nip in the bud, and I just want to thank you very much. There'll be a link at the talkingabout.info website for more information. Thank you again. Thank you for watching. I'll see you next time.
Thank you.